Your digestive system has a funny way of getting your attention. A little heartburn becomes something you deal with every week. A stomachache keeps coming back. Your bowel habits change and don't return to normal. Or maybe your primary care provider tells you it's time to see a gastroenterologist. And that's usually when the next question appears. Okay, but which gastroenterology clinic should I actually call? Welcome to Review Remedy by ScoreDoc, where we take healthcare research and turn it into practical information you can use. Today, we're looking at 3 best gastroenterology clinics in and around Arlington, Texas in 2026. But we're going beyond simply naming 3 clinics. We'll talk about when a gastroenterologist may be appropriate, what to ask before booking, and how to prepare for a GI appointment so you get more out of it.
First, let's talk about what gastroenterology actually covers. Gastroenterologists specialize in the digestive system, including the esophagus, stomach, small intestine, colon, liver, gallbladder, and pancreas. That means they're involved in a surprisingly wide range of issues. Persistent heartburn, abdominal pain, changes in bowel habits, inflammatory bowel conditions, liver problems, and screening or diagnostic procedures such as colonoscopy. But here's an important point. You don't necessarily need to diagnose yourself before seeing a specialist. If your primary care provider recommends a gastroenterology evaluation, or you're dealing with persistent or concerning digestive symptoms, the specialist can help determine what's actually going on.
Let's start with Arlington Gastroenterology Services. It's one of the 3 providers featured in ScoreDoc's 2026 list for the Arlington area. When you're considering a gastroenterology practice, one of the first questions to ask is, do you treat the issue I'm being referred for? It sounds obvious, but gastroenterology is a broad field. If you're being referred for persistent reflux, for example, your questions may be different from someone being evaluated for liver disease or inflammatory bowel disease. When you call, briefly explain why you're seeking care and ask whether the practice handles that particular concern. That can save you time.
The second provider on today's list is Southwest Fort Worth Endoscopy Center. And this brings us to an important distinction. A gastroenterology consultation and an endoscopy procedure aren't necessarily the same thing. If you're being scheduled for a colonoscopy or another procedure, don't assume the process ends with simply showing up on the appointment day. Ask beforehand, what preparation is required? How long should you expect to be there? Will you need someone to drive you home if sedation is involved? When and how will you receive the results? And who will explain what happens next? Those questions can make the entire experience much less stressful.
Our third featured provider is Texas Digestive Disease Consultants, Fort Worth Southwest. For someone researching gastroenterology care around Arlington, this is another option to consider. And here's one of the most useful things you can do before a GI appointment. Keep a symptom diary. It doesn't have to be complicated. For a week or 2, write down what you ate, when symptoms appeared, what the symptoms felt like, how long they lasted, your bowel habits, if relevant, and anything that seemed to make the symptoms better or worse. Patterns that aren't obvious on a single day can become much easier to explain when you've written them down.
Now, let's say these 3 practices are on your shortlist. How do you compare them? Here's a simple GI clinic checklist. Number 1, the reason for your visit. Make sure the practice handles the condition or procedure you're seeking. Number 2, location and convenience. If you need multiple appointments or follow-up visits, travel time matters. Number 3, insurance. Confirm that the provider and, when relevant, the facility where a procedure is performed, participate with your insurance. Number 4, procedure logistics. If you're having an endoscopy or colonoscopy, ask about preparation, sedation, transportation, and follow-up. Number 5, communication. Know how you'll receive test results and who to contact if your symptoms change or you have questions.
There's another conversation people sometimes avoid because it's uncomfortable. Bowel symptoms. Changes in bowel movements, blood in the stool, constipation, diarrhea, bloating, or changes in frequency can feel awkward to discuss. But for a gastroenterologist, these are routine medical questions. Don't edit your symptoms because you're embarrassed. Details like how long something has been happening, how often it occurs, and whether there's blood, weight loss, fever, or significant pain can be medically important. Being specific isn't oversharing, it's useful information.
And here's another practical tip. Bring your medication list. Include prescription medications, over-the-counter drugs, vitamins, and supplements. Also bring relevant medical records if they're available, especially previous imaging, laboratory results, or procedure reports. If another doctor referred you, make sure you understand why you're being referred and what question the specialist is expected to answer. That can help keep the appointment focused.
One more thing worth remembering. Don't ignore persistent or concerning digestive symptoms simply because they're inconvenient or embarrassing. Some symptoms are minor and temporary. Others deserve medical evaluation. And certain warning signs, such as significant bleeding, severe or worsening abdominal pain, persistent vomiting, fainting, or other serious symptoms, may require urgent or emergency medical attention rather than waiting for a routine specialist appointment. When in doubt about a potentially serious symptom, seek appropriate medical guidance promptly.
So if you're in Arlington or the surrounding area and researching gastroenterology care, start with the ScoreDoc list. Explore the 3 featured practices, then compare the details that matter to your situation. Because the best gastroenterology clinic isn't simply a name on a ranking. It's a practice that fits your medical needs, access requirements, and expectations for care.
We've included the complete ScoreDoc guide in today's show notes, so you can continue your research. And remember, you don't need to become an expert in gastroenterology before making an appointment. You just need to ask good questions, describe your symptoms honestly, and understand what happens next. Thanks for joining us for another episode of Review Remedy. Until next time, listen to what your body is telling you. Don't be embarrassed to ask questions, and make healthcare decisions with information, not guesswork.